I wouldn't miss this. I'm very happy to be here. And this is a very important topic. We're getting daily updates. I had to update the slides last night around 1 o'clock. We were trying to do that. So this is these cases are coming in every day, and it's very fluid. So the presentations that I do need to be constantly revived. Are they going up? I see one. I see the other. Okay, fantastic. We're going to go through these quickly because there's a lot of information. This is what I'm going to try to go over. So on March 1st, the Florida Department of Health reported Florida's first 2 cases of COVID-19 in Hillsborough and Manatee County. That gave the governor the order to issue the Executive Order 2051, directing the public health emergency and establishing the Florida's response protocol for the COVID-19. The state surgeon general at that time made the declaration of a public health emergency for the state of Florida. The outbreak began, as you all know already, in China. The first cases were linked to seafood and live animal market, and then it became person to person. It has spread throughout the United States. These numbers get updated, so I'm going to go to the next slide. This is the picture of, well, you're only seeing the blue. Somehow the gray areas don't show up. So what's missing there is the continent of Africa that only has a few places. Now remember, there's a large desert there, so hopefully there's no corona in the desert. At this point, we have, this one doesn't have the notes. This is the United States now. As you can see, there are many more countries. There are now 35 states that are reporting the coronavirus. The spread is person to person. The way it spreads is the droplets from an infected person, when you cough or sneeze, spread a distance of about 6 feet. You have to come in contact with those droplets. Once the droplets fall and they dry, they're no longer contagious. But in that meantime, it is very easy then for someone to come along and touch that doorknob, that hand railing, the table that you're sitting at. But if your hand touches those droplets, you're not infected through your skin. It's very important that people realize that. What you have to do then in order to get infected is you have to raise your hands to your face, touch your eyes, your nose, or your mouth in order to inhale those air droplets. So it's not as hard to catch as you think. However, that is how it spreads. So there are many things that we can do, and I will be talking about those things that we can do that are very important. These are the symptoms. They're very vague symptoms. Fever, cough, difficulty breathing. That's the key, is that difficulty breathing. It's really more for people who have asthma. They understand what I'm saying, but that's one of the key features that's different from just having a regular cold or feeling achy and bad. But because they're so common, it's really very important that if anybody believes that they have it, that they go ahead and make the calls, and I will give you the numbers of where to call. Because there is no specific treatment for this virus, there's no medicine for it. It's a viral infection, so antibiotics do not work. Antivirals that help the viruses go away faster are being developed, but they're not ready yet. There's also no vaccine. Vaccines and antivirals take quite a long time to produce. Because the coronavirus has been around before in other forms, there's many coronaviruses, they do have and have been working on an antiviral for it, but at this time it does not exist. And the vaccine probably takes, between 18 to 2 years to actually, once it starts working, then you have to actually use it on people, and there may be some of that already going on. But for right now, we don't have anything. So the only thing that we can do is to support the person that has it through hydration. Make sure you're drinking water. You can take antipyretics for the fever, and just stay home. Don't go to work or go out in public so you don't spread it. For those people who then become severely ill, specifically the lungs are what are affected, those people then may need to be hospitalized. So the hospital and your doctor and the health department will help make those decisions, especially if you need to be hospitalized. The testing is only available through our state labs. The test kits have been given to Miami, Jacksonville, and Tampa. And so we still have the responsibility to make sure that the person has symptoms. We have eliminated the travel criteria, so now, because we now have person-to-person transmission here in our state and in the country, so we've eliminated the criteria that they have to have travel, but we're still going to ask, have they come in contact with anybody? Have they been to places where they could have caught the virus? And so we're using those, and we're expecting the commercial labs to come on board at any time. Then the doctors will be able to send it to the labs like our commercial labs here in town. The international travel or contact with risk could obviously put you at risk. So anybody who has traveled in 14 days, especially those who have gone to the specific areas that are at high risk, need to beware and make sure that they're looking at their symptoms and that they contact us if they feel that they are at risk. If you think that you are at risk, you obviously can call your healthcare provider, your doctor, tell them about your travel, tell them about your exposure, and at that time you want to avoid contact with other people. We don't want you to travel while you're sick. We also want those people to cover their mouths and their nose when they're coughing or sneezing. And once the doctor tells them to either come into their office or go to the hospital, they need to wear a mask so that they're covered and they don't spread their coughing or sneezing to other people in those waiting rooms. And of course, we tell them to wash their hands as frequent as possible. So this is the diagram that we've been using to make sure that you wash your hands, that you can use sanitizers. It needs to have 60% of alcohol in it to be effective. Take a look. You might be buying things that don't have 60%, so you're wasting your money. But the most important thing is to avoid, again, touching your eyes, nose, and mouth so that you don't spread that to yourself. And of course, we want everybody to stay home when they're sick, not go to work, not go to school, so that we don't spread this to other people. There's a new CDC travel advisory. There's been some confusion the way perhaps it was put out. This is to countries. They're avoiding, they're giving this criteria for people who travel to countries in level 3 and in level 2. The way it was written, you had to click on the website down here, the one that you see in blue, in order to see what level 3 and level 2 is. So I'm telling you, I'm putting it in English so that you can see it. If you travel to countries in level 3, which is China, Iran, South Korea, and Italy, you're in level 3. You've traveled to a level 3 country. Level 2 is Japan, and they're including any cruises. So this is a new travel guideline. It says that if you've traveled to a level 3 country, you need to do mandatory 14-day self-isolation and practice social distancing once you come to the United States. And that means you're going to avoid going out in public. You're going to avoid any contact with other people outside of your home. And if you become symptomatic, if you start having the symptoms, then immediately contact the health department and your health care provider, your doctor or whoever you go to for primary care. And by the way, for people that don't have insurance or don't have a provider, the federally qualified health centers in town will be able to help you. If you've traveled to a country level 2, that's Japan, or any cruise lines outside of the country, then they just want you to monitor your health and just maintain limited interaction for 14 days. So you can still you don't have to self-isolate, but try to stay away from as many people as you can. And then if you become symptoms, then immediately self-isolate and then contact the health department and your provider. So we're monitoring. We get lists daily. All 67 counties in Florida are working with our state epidemiology department up at the state level. We're working with the CDC, and we're getting constant lists of people that we need to interview, that we need to monitor. We go to their homes. When we go to their homes, we make sure that we don't wear our protective gear when we're walking into the home. We contact them. Sometimes we meet them in the garage. Sometimes we meet them around the back of the house so that the neighbors and the rest of the people don't get intimidated. People can be very ugly when these things come up. So we want to make sure that we keep that in our minds. For people that have been exposed but have no symptoms, this is the process. They stay in for 14 days, stay home as much as possible. They avoid traveling to any public places and avoid public transportation. And they're excluded from work, school, and other public places. Those who are suspected, then they also are at home. They don't participate in public activities either or travel. So the immediate risk for all of us remains low, but we need to really do everything we can in order to stay healthy, in order to not spread this disease. Now, let me talk a little bit about the masks. There are two types of masks, basically. There's the regular mask that you see on TV that people wear. It's basically a square with two ties that tie behind your head. Those are called surgical masks, and they protect the person who has the coughing and the sneezing from spreading it to you. They do not protect you from the virus. Why? Because there's openings on the sides. The only mask that protects the provider or the physician that's working with the patient is called an N95. An N95 mask has to be fit tested because it has to seal completely around your face so that nothing can come in. The person must also wear goggles so that nothing gets into their eyes, gloves, and some type of gown so the stuff doesn't get on their clothes. So that should be reserved for the people who are examining patients, people that are treating them, the people in the hospital, the people that are treating the patient on a ventilator, not for the general public. Okay? So we shouldn't be walking around the streets with masks, even though you're going to see people doing it, because it really doesn't help you. Now, if you are the one with a cold or something, you're sneezing, then yes, then you're helping the public. But the mask is not going to help you. So having said that, we got to realize that the masks are in high demand and they're back ordered. Right now, if you try to buy a mask, you're not going to get one because they're all out. So is bleach and wipes and everything else because everybody's gone to the store and bought everything out. Some stores are being wise and they're limiting the amount of bleach that you can buy to 2 per household. And they are getting supplies in every day, but it's limited because everybody's trying to buy it up. So I want people to be very cautious with using the mask. Our first responders need the mask. Our healthcare workers need the masks, and we want to save and protect those as much as possible. So please don't waste masks. With that, I'm going to turn it over to everybody else so they all have time to talk and I don't eat up all the time myself.
Dr. Alonso, do you mind if we ask you just a couple quick questions prior to going to a different public official? I'll start with Commissioner Bernard.
Thank you very much, Dr. Alonso. I know you've been working really hard and diligent on this issue. But, since we have, so many seniors in Palm Beach County, do you know how many people in Palm Beach County that's been tested so far?
I can't give you specifics, but we do have, in Florida, we have tested 115 115 tests are pending results. 140 have been negative, and out of the 18 cases, now there's one more case in Fort Lauderdale that came in at 1 o'clock in the morning, so we have 19 cases. 12, there have been 12 diagnosed in Florida, 5 diagnosed and isolated in other states, and 1 confirmed positive who's a non-Florida resident but is isolated in Florida. So some of the patient, the way the person gets registered to the state is with their home address or their P.O. box. We've had a couple that are P.O. boxes. And so they may be or not be in the state of their home address. So we have one person that is here but is not from Florida.
Follow up, Mrs.
So we're monitoring, at this time, we're monitoring 302 that are being monitored and 808 that are no longer being monitored. So it's quite a few that has been going on.
But is there a possibility to know, like for Palm Beach County's sake, in terms of the amount of tests that's been done for Palm Beach County?
We, at this point, are not allowed to give out that number because the number for an individual county, we're trying to do the same for all counties, can be very small, and then that person can be identified. But what we are going to do is we're going to be able to give first responders the ability to know the address in case they're going to somebody who's being monitored. So we will work that out with all our 911 calls so they can know who they're getting. And of course the hospitals know everybody coming in because we report that to them as the patient's coming in. Nobody should be going to the hospital or to a clinic without calling ahead first.
So how would, the public, like I'm saying we have 1.5 million residents that lives in Palm Beach County. Like how would we know if anyone in Palm Beach County has been tested at all?
Well, you don't know who's been tested for many other communicable diseases, such as sexually transmitted diseases. There are a lot more of those than the coronavirus.
We're not talking about that. We're talking about
we don't give out people's tests.
I'm saying as a community, like why can't we know how many people have been tested?
Well, we're giving the congregate for the state so that people can't be identified in a small community. It would be very easy to end up tracking that down. When people go to the hospital and things like that, the word gets out very quickly. So we're trying to protect people's private medical information, at the same time giving the information that we need for fire rescue and other folks to be safe.
Now, you had mentioned that we don't have any commercial tests available yet.
Correct.
What's the status of that, and how quickly do you think that our Palm Beach County residents would be able to get commercially tested?
I have the dates that they have given have come and gone, so I can't guess what those steps are or when that. They're saying soon, but I don't have that information.
And would you mind you said they have given who?
These are commercial private labs that have agreed to do testing.
Okay, so they're the ones who have given the dates.
Mm-hmm.
Okay. You had mentioned, I think you had mentioned cruises to not travel. In Palm Beach County, we do have a port. Have we had communications with the Port of Palm Beach in regards to the cruise?
Yes, and Bill can talk to you. We're talking to every single partner. We've emphasized that at every one of our meetings that we've had. We have a very good incident command structure here in Palm Beach County where we all stay in touch with one another. We talk to each other frequently. Right now, our neighbor to the south is having a huge problem with a cruise ship that came in, and they have had several people get tested and be positive. So they have a big warning in Fort Lauderdale. Anybody coming out of that cruise specifically are being asked to, any symptoms, immediately report to the health departments, wherever they are. And that's the problem. These crews come in with thousands of people, and then they go all over the state and all over the country.
Okay, one last question. And so as of right now, we don't have any residents in Palm Beach County that's tested positive?
As of this morning at 6 a.m. when I left the house, there were no cases in Palm Beach County.
Okay, thank you very much.
Thank you, Commissioner Bernard. Commissioner McKinley, you're recognized.
Thank you. Dr. Alonso.
Good morning.
I have pulled some data from the CDC website regarding the flu. And in 2017, 2018, there were 45 million infections, 810,000 hospitalizations, 61,000 deaths. 2018, 2019, 35.5 million infections, 490,600 hospitalizations, 34,200 deaths. This season that we're currently in for the flu, so far 32 million infections, 310,000 hospitalizations, and 18,000 deaths. That's just in the U.S. In the U.S. so far on the coronavirus, we've had, this is probably about 24 hours old, 539 cases across 34 states and 22 deaths.
Thank you for that data, which reminds me, by you saying that, allows me to say, if you haven't gotten your flu shot, please get your flu shot. You're more likely to die from influenza than from the coronavirus at this time.
Thank you. There was a question in that data that I was getting ready to roll out. How is our response to what we're dealing with now in the coronavirus versus what you've had to deal with in the flu season with H1N1? How is it different?
It's not different. The virus is acting exactly like all new viruses act. They start in Asia because of the practices of eating wild animals and raw animals in their markets and so forth. So this is very common that this occurs. And then it spreads person to person because it's new. Nobody has defenses. If all those people who have caught the coronavirus now have life immunity against that, so they won't get sick from the corona again. And so that's how it spreads. It spreads from person to person, country to country. The more global travel we have, the more quickly that those spread. In the beginning, we try to contain it as much as possible to give us time to get ready, to build up our infrastructure and our communications with our community. So this is very much exactly what happened with H1N1 in 2009. It spread to us across the border of Mexico, and actually the H1N1 was even more severe. This one is mostly affecting elderly. The H1N1 was affecting babies and pregnant women. So at this point, that has not occurred with this virus. So the concern is, that's why we're still saying we are at low risk, because those numbers that you mentioned are very important, and it's very important that we keep that in mind and that everybody please remain calm. Even in the worst emergency, the most important thing is always to remain calm so you can do the right things. There's no need for panic, and that's why we're having these meetings, and the most important thing is the correct information. So thank you for quoting all that data.
So the risk factors for your average healthy, adult, any different? The risk factors for the flu versus this virus? If you're a 35-year-old healthy adult, no underlying health conditions, if you get the flu or you get the coronavirus, are you going to feel a major difference?
You're going to be sick, and you want to stay home because you're sick and you don't want to spread it.
Is that any different than what you would tell somebody with the flu or a stomach bug?
That's exactly what we tell people with the flu and the norovirus. We do that. That's happened in ships before also. So yes, that is the same, but we have to have that information. So we will see even a low, right now the fatality rate is around 2%, which is very high. That is what has alarmed people. But what they don't realize is that that number is so high because we've only been testing people that are really sick and in the hospital. So the fatality rate is the number of deaths divided by the number of people that we've tested that we know have the disease. Probably 90% of the people that have had the disease, we haven't tested them, especially in China. So as we test more people here, that number will become more normal, like the other influenzas and H1N1. Those numbers will go down. That's the importance of testing for that statistic.
Right. And so your advice to wash hands and not sneeze and cough on people and stay home if you're sick is pretty much the same advice as you would give anybody else with any other illness.
Correct. And that's really all that we can do. There's no antivirals for this. There's no vaccine. So the only thing that we can do, and that's why we keep repeating that, because we have to protect ourselves now from the virus by doing that.
Okay. Just repeat for me again, the segment of the population right now that's most at risk for developing complications from this.
It's the elderly who have chronic diseases, but specifically what we're seeing in the cases is people with pulmonary diseases. When you inhale the virus goes into your lungs. So if your lungs are already compromised, those lungs aren't able to fight off the virus. You and I, hopefully, I don't know, I'm one of those old people now, so maybe I can't say me, but young people will be able to fight this off unless they also have some kind of compromised problem, obviously. I mean, some young people may get into trouble. Remember, there's no absolute in medicine, so I can never say those things. But yeah, the people that we're seeing with the big problem. Now, because we have such a large population, specifically in Palm Beach County, it is very important that we reach out to the elderly and that we make sure we get that message to them.
Okay. And I don't mean to sound like I'm brushing this off, but we're dealing with a new virus. It mimics viruses that we've had to deal with in the past. We have a segment of the population that's highly at risk, and we need to make sure that we're doing universal precautions like we would do in any illness event.
Can I get you to come and just talk for me at my presentations?
Well, I mean, I'm looking, Dr. Alonso, I was talking to my daughter who's up in school in Tallahassee, and she said, she has a girl who's probably going to be her roommate next semester, and she's supposed to go on a foreign exchange program, and all of the foreign exchange programs have been canceled. I think it's JM Enterprises down in Fort Lauderdale has sent all employees to work from home. I mean, we're talking about shutting down every group activity, conventions, everything. I mean, we're about to take a major hit to our economy, particularly our tourism economy, which is how many jobs in this county, Ms. Baker? 95,000 jobs. I just think that we need to realize that we're just dealing with something new, and we need to have some common sense about it and, not make a run on the toilet paper in the grocery store. Although I think that has more to do with the supply chain out of China right now than it does people needing extra toilet paper. But I want to thank you for working so hard to get the word out. I have one last question for you. We all know what an FQHC is.
I'm sorry.
But could you just on the record mention the names of our federally qualified healthcare centers in Palm Beach County that people can reach out to?
Absolutely. Federally qualified health centers are Found Care in Palm Springs. They have an office up near St. Mary's also for pediatrics. Genesis, who is in Boynton, and the healthcare district, C.L. Brombeck clinics, which are spread out throughout the county, including Belle Glade. So they're preparing and getting ready to have the testing material and the cultures that are then sent for testing so that they can do that and that they can take care of patients.
And just one more time, people should not just run into those clinics or run into their doctor's offices. They should call ahead, explain their symptoms, and let the medical professional determine whether or not they should come in.
Yes, all doctors' offices and the emergency room, walk-in clinics are all urging their patients to call ahead if they have any symptoms such as coughing and things. It includes the influenza virus also, because you don't want those people, and we've all been in a waiting room with people coughing around us, and we automatically cover ourselves up. So yes, those people should come in. Most of the offices will have masks. You should come in with your own mask. If you don't, you can always cover yourself with the old handkerchief. You remember the cowboys used to ride on the ranch so they wouldn't get dust? Yeah, just cover your face so that, and your nose, so that you're not coughing and sneezing on the people around you.
Thank you, Dr. Alonso.
Thank you, Commissioner McKinley. Commissioner Valasche, you're recognized.
Thank you, Mr. Mayor. So I know it's yet to be determined, but I'm wondering if you have an opinion. A lot of these similar viral strains tend not to proliferate or survive when the weather gets warmer and in warmer climates. And it seems like, they're generated in cold climates. Do you believe that COVID-19 will be susceptible to a warming up in the summer?
What they do is these seasons. And so the virus normally would stay in the northern hemisphere in the winter because that's when they proliferate, and then go to the southern hemisphere because it's winter in the south when it's summer up here. So the virus is going to maintain activity, and because there's global travel, people are still going to be traveling back and forth between hemispheres. So the virus will not disappear. H1N1 took 3 years before the numbers came down. So that's what we can expect.
But you would expect it to behave similarly to the flu and other viral outbreaks?
Yes, it is a viral
in terms
outbreak.
Of climate. Yeah, but this isn't different from every other viral outbreak that we've seen that wanes
it's new.
in the summer.
I don't know how it's going to behave, but we expect it to behave like a normal viral infection.
All right, thank you.
Thank you, Commissioner Valasche. I have just a couple quick questions. What's the antiviral timeline, if any?
I'm sorry, say that again?
Antiviral the production or the discovery?
I can't comment on that. I have no idea what they're doing or how they're doing it. I don't have information on that. I'm sorry.
Okay. Who's the decision maker as to whether someone gets tested or not by the state?
The decision is made with our information, and we have a protocol to follow. We've taken out the criteria for travel.
Which enlarges
Largely, the person has to have some symptoms.
Okay. And
then we try to take the history in terms of who they've come in contact with. That's quite in depth. So we talk to the patient, and we also talk to the doctor that's actually treating the patient. That conversation takes place. If there's extraordinary circumstances that still needs to be tested, then we call our state epidemiology. We converse. Sometimes they say, yes, go ahead and test. We haven't had any problems with people with symptoms and medical information to test. If there isn't any connection or there isn't any criteria to test, then they call the CDC, and that conversation can be had with the CDC. Sometimes they say yes. If there's no real criteria, then they are not tested.
So is it the Florida Department of Health that ultimately makes at this time the decision to test at the state lab, or is it at the CDC level?
With the state and the CDC.
Okay. Is any of the sort of the triaging of who gets tested and does not, is that a function of a lack of test kits, or what's the reality about the supply?
We're following the FDA, the ones that created the tests, the guidelines that they have given us. We don't want, there's not unlimited number of tests, so we want to make sure that we are testing the right people. And a person who doesn't have any symptoms, we
Probably
don't feel
wouldn't
that
have
that's
been
appropriate
tested.
to test them based on the guidelines that was set up for the test. So we're following the guidelines that the test was designed for.
Okay. Do you feel that there are enough test kits accessible in the state of Florida?
We in Palm Beach County have had no problem. I can't speak for other counties, but we in Palm Beach County have had no problems with the test kits.
Good morning, Mayor Kerner, Vice Mayor Weinwath, Administrator Baker, and the Board of County Commissioners. On behalf of the school board, I appreciate the opportunity to collaborate with Dr. Alonso and the Florida Department of Health and with the Board of County Commissioners. Dr. Alonso graciously updated our school board last week. It's through collaboration and coordination with local, state, and federal officials that our schools are taking deliberate steps to disseminate information about coronavirus and its potential transmission within our school community. As Dr. Alonso stated, it is imperative that we as a county and state leaders remain calm but deliberate in our efforts to inform and protect our community. As an educator and as a father of 2 children in the school system, I know how important it is to maintain a sense of normalcy for all of our children. Principals at our 179 district-operated schools are going about their day with their normal lessons as much as possible. While there are no known cases of coronavirus in Palm Beach County, I would like to assure the board, as I have the students, staff, and parents, that the district is being proactive. There is a lot going on behind the scenes. The district continues to enhance deep sanitation methods, which I initiated late last month. In the audience is Mr. Paul Strauss, who's the head of our Environmental Services Department, staff of professionals trained in environmental project management and infectious disease response. Our schools are also staffed with highly qualified nurses who are truly our eyes and ears as we monitor infectious disease on our campuses. These healthcare professionals report illnesses and trends so that the district can respond in real time and, when necessary, involve the health department. Additionally, district administrators have a comprehensive infectious disease response plan in place to ensure that learning continues in the remote chance that our normal operations are disrupted by an outbreak. In an abundance of caution, I have suspended district-sponsored out-of-country field trips. I am also recommending that students and staff cancel any non-district-sponsored international field trips booked through a third-party vendor. In-country, district-sponsored field trips are still permitted, but we will cancel if the health and safety of our students become a concern. In my continuance, who may be visiting high-risk countries over spring break, to be well aware of the CDC recommendations to self-quarantine for 14 days upon their return. I have directed district administrators to provide daily updates to parents and staff as the situation is evolving from day to day. The district has also launched a website available in English, Spanish, and Haitian Creole, dedicated to providing information and resources about coronavirus. The website is updated daily. In fact, this board meeting is streaming live and being recorded on our district website right now. For all those in attendance, please visit palmbeachschools.org/coronavirus for the latest updates. At this time, I turn it over to the chairman.
Chairman, you're recognized. Thank you, Dr. Fenoy, for those comments.
Good morning, Mayor Kerr. Son? No.
Yeah, make sure the button's pressed.
Good morning,
Okay.
Mayor Kerner, Vice Mayor Weinroth, Madam County Administrator Baker, and members of the Board of County Commissioners. I, too, would like to thank you for this invitation to collaborate and update you on the measures in motion to maintain the health and safety of our school district students and staff. We believe that it was important that both the superintendent and I be here today to ensure that the parents of our almost 200,000 students understand that both the school board and the administration take their concerns seriously. Like the superintendent, as chairman of the school board of Palm Beach County, there is no greater responsibility than representing the students and staff of the school district and ensuring that our campuses are safe and our children are as secure as possible from all threats. Our school board is united in its commitment to the welfare of our students and staff and will remain vigilant on our leadership through this current health concern and beyond. Despite being the 10th largest school district in the United States, our district is tight-knit. Our parents reach out to me and other board members directly with questions and concerns. I and my colleagues feel a personal responsibility to every child, parent, and staff member in this district. As a district, we are indebted to you, our commissioners, our health department, and other Palm Beach County leaders who are currently collaborating with us in an effort to prepare and persevere should coronavirus impact our community in general and our school district in particular. We will maintain open lines of communication with you. We will work collaboratively, and we will emerge from this stronger as a result of that collaboration and our combined efforts. On behalf of the entire school board, I thank you for the many years of support that the Board of County Commissioners has given to the school district of Palm Beach County. And I hope you realize the significance of that support, as it has had a positive impact on the lives of the many hundreds of thousands of children who have been educated in and graduated from your Palm Beach County Public Schools. Once again, thank you.
Thank you, Chairman Barbieri, and I'll alert you that I'm one of those former students that graduated from one of your great schools, so thank you. I'll turn it over now to Commissioner Weiss for questions.
Thank you. Thanks for being here. And, you know, in other parts of the country, we've seen some school closures. And if that were ever to come to Palm Beach County and our schools, I know a lot of our children receive their meals at school. Is there a plan on how we'd be able to continue to support feeding those kids if that were necessary?
Yeah, so the good news is that the school district works hand in hand with the county during our hurricane protocols. And so all of those protocols, we would just activate all of those responses, and we would coordinate appropriately to make sure that we would have feeding stations for those who needed to access food.
Okay, thank you. That's my only question.
Thank you, Commissioner Weiss. Commissioner Bernard, you recognized.
Thank you very much. Dr. Fenoy, I just have two questions. Can you tell the community, you mentioned spring break, I have 3 kids in the school system, so can you please tell when is spring break so the public would know when spring break is, and what would you advise to some of the parents and some of the community in regards to spring break?
Yeah, so spring break is the last week of March, so in 2 weeks we will commence spring break. Again, what we're asking as a school district at this point is taking advice from the CDC and other state and federal officials to limit international travel, to follow all protocols that have been established by all of our agencies around returning. At this point, we just need families to make wise decisions because, again, if you participate in international travel, there's a strong likelihood upon entering the country that you're going to be asked to self-quarantine. Or something even more serious if they find that you carry that disease. So what for us as a system during spring break, we'll be preparing for people returning and figuring out what those next steps. The good news, thanks to what I just heard the sheriff and Dr. Alonso say, we'll be able to have some information if confirmed cases are there, and then we will respond accordingly.
Thank you. One more question, Mr. Mayor. You had mentioned, in terms of not advising for, out-of-country trips, but what about, in-country trips, such as some of the most infected areas, such as California or the state of Washington or New York? What would you advise some of the principals and some of those individuals to work on?
Yeah, so our team is sending out daily communication. Yesterday we sent out a pretty lengthy communication to our community, letting them know that we are monitoring every field trip case by case. And so we are absolutely, they have to come through executive cabinet, and we've already had to unfortunately cancel some. But we're taking it case by case, similar to what Commissioner Mckinley said. We are not in a position that we want to just shut down the economy. So again, we're paying very close attention, getting the most up-to-date information and making those decisions. As I stated at last board meeting, as a superintendent, I reserve the right up until the day of to cancel any trip, depending on the information that we receive.
Thank you very much.
Thank you, Commissioner Bernard. Commissioner McKinley, you're recognized.
Yes, thank you. A comment and a question. Commissioner Weiss, there's an article in Politico today on that very subject about school officials pressuring USDA to expand access to free meals. Secretary Perdue is indicating that there are some glitches in the law that may prevent that from happening. There are a lot of exceptions, so it might be something our legislative affairs team can look into for us. Dr. Fenoy, 3 out of the last 4 years I had graduating high school seniors. Thank God I survived all that, but I got more than my fair share of 10 absence notices from my kids, especially their senior year. And what that means is basically if they have more than 10 absences, they have to pass the final exam no matter what their grade was in the class, or they fail the class. So for these kids that the parents make the decision to take them somewhere and they've got to come back, and the parents decide to do a self-imposed 14-day quarantine, what are we doing to make sure that that child's education will continue while they're at home, and make sure that that 10 absence requirement doesn't affect them?
Yeah, so the deputy superintendent and his team have developed a series of protocols in the event, and our IT department, if we have to have children at home to work remotely. Some of the decisions that relates to the 10-day absence will actually be augmented by the state because those are just rules that we follow. But trust me, we are well aware of that. My wife has asked me that question several times. And I said, well, my kids going to school. Their dad just happens to be the superintendent. But needless to say, I think we were well aware of that. In addition, let me just say for the record, we've also been having conversations around graduation. As of today, we will not cancel any graduations, but we have made the decision to not shake hands at the graduation, just out of an abundance of caution. And any other further changes to those ceremonies, we will let the community know in real time.
Okay, and I don't know how you don't have arthritis in your hand from all those handshakes anyways. That might not be such a
the
bad
first
idea.
time the board told me that I would be at every graduation and shake close to 15,000 hands, I'm like, well, I'm 6'4", 300 pounds. I can take it. When I went to the chiropractor, my back was completely out of line. And then last year, Mr. Barberry said, "Is something wrong with you?" Because I just started breaking out at a graduation. So it is definitely a process of endearment, but I love it, and we look forward to doing everything in our power to keep kids in a normal situation as possible.
Thank you.
Dr. Alonso, you're recognized.
The issue about the 14-day quarantine has been mentioned several times, and I want people to understand that international travel level 3, China, Iran, South Korea, and Italy. Those are the only 4 countries that are on that level 3. The level 2 is Japan and on cruises. Those you just have to come home and make sure if you have any symptoms. You don't have to be isolated and you don't have to stay home. So, because there was a little bit of confusion. Travel, that is not correct. So I want to make sure people get that right from this presentation. They don't get confused.
Well, in all fairness to the papers, I think that was an initial directive from the CDC, who went back and then said only if you come back and you're presenting symptoms. So
they had to click on the CDC site to see which were the level 3s and the level 2s. We sent out a new information. I had to send it out to all my staff and to everybody because people didn't click the site to see what level 3 and level 2 were. So we try to clear it up by a new message.
Very good. Before I recognize Vice Mayor Weinroth, and while I have your attention, what is the practical effect of the governor's state declaration of the state of emergency?
It allows money to come down to the state when it's distributed, and thanks for all the House and the Senate that actually passed the bill, and the money should be coming down, so that's very helpful.
And what is the metric or metrics used by the governor's office to determine that that order should have been issued?
I'm not aware of the actual metrics. Usually most of our money comes down based on our population, so the more population you have, the money gets allocated. But I have no idea. I just take what we get. So.
All right. Vice Mayor Weinroth, you recognized.
Thank you. Thank you, Dr. Fenoy. I appreciate your presentation. A lot of parents who are watching today are probably thinking ahead about the possibility that the school system may have to react to a cluster of patients within a specific school or within the district in general. Can you let them know what the school district is going to do if there is a cluster? Is it going to be a system-wide reaction, or would you stay focused on the individual schools where there might be a problem so that they can start making plans for child care and again, disruption in the family routines?
Yes, so we are actually in the process, again, similar to hurricane protocols, doing tabletop exercises in reference to this. So the honest answer today is we would work directly with the CDC and the health department to determine as much as possible to contain it in one school. And then we would, but as we would get real-time information, then we would expand it. That is not a decision that the school board will make in isolation. It would be a joint effort to determine what the steps would be. I just know of a district outside of the state of Florida that shut down the entire system. But there are a lot of consequences shutting down an entire system when the school where the person was infected is almost 100, it could be 50 miles or 100 miles from another school. So we have to just be clear that those decisions will be made in a joint effort and it will happen in real time. But we're going to communicate as rapidly as possible and then put all the resources around those things at that time. Yes, sir.
Thank you very much.
Thank you. I don't have any further inquiries from my colleagues on the board. As to the school board, thank you for your presentation and information today.